Hi, friends. It's Dr. Dena Grayson, and thanks for joining me tonight on Leap Year Day in 2020. I wish, honestly, it were a better occasion, but I decided that I would make this video because I know that lots of you have tons of questions about coronavirus. It's kind of scary in some ways, but first of all, I just think everyone needs to take a really deep breath. So, this is not the zombie apocalypse. We're not all going to die. This isn't the end of the world. So, that's the good news. But it certainly is a serious situation. So, I thought that I would come here and fact bomb you, unlike Mr. Trump, who likes to spin nonsense. So, let's talk a little bit about the coronavirus, what it is, what's COVID-19, where are we at today. I want to answer some of your questions as well. Obviously, we can't cover everything, but hang in here with me, and hopefully, we can cover a lot of the things that you're thinking about, worrying about, and want to know, well, gee, what can I do to protect myself? I'll also kind of try to give you a little bit of insights on what I think is going to happen next. I mean, obviously, that's not easy. I don't have a crystal ball, but I do have a lot of expertise in studying viral illnesses, as I spent nearly a decade developing treatment for Ebola and other pandemic, what we call biothreats. So, unfortunately, this coronavirus fits into what we call kind of that pandemic risk biothreat. And why is that? Well, I tweeted for those of you who know me well and you follow me on Twitter. I do tend to tweet a lot. But back in January, around January, I believe 24th, so over a month ago, I tweeted about the outbreak of coronavirus in the epicenter, Wuhan, China. And I said, this is just the beginning. And I meant it. And I wasn't trying to be a fear monger, but I meant it based upon science and data. And the reason why coronavirus is so serious is because, first of all, it's highly infectious, meaning that one person that gets it can spread it to multiple people. Now, how many people that really is hard to say because we're relying on data coming from China, which is not exactly the most reliable place for data. So let's say on average that person infects 3 people. You can imagine then that next person gets infected and so on and so on. So highly infectious, aerosolized, and coronaviruses in general are pretty easy to spread because in fact, a coronavirus, different flavors, if you will, of coronavirus cause about a quarter of common colds. But sometimes there's a leap. For example, what's thought to have happened with this new coronavirus from China, a leap from animals to humans. And our immune systems aren't quite used to this new one. So it tends to spread faster and cause more serious illness. So that's the second thing that we worry about with biothreat, pandemic risk. So spreads easily. And second thing, can cause serious illness or death in otherwise healthy people. Now, again, I'm giving you the bad news up front, so hang in there. It's not terrible. This is not the zombie apocalypse, so hang in there with me. Now, the last thing, of course, that is not good news is that there are no vaccines or treatments yet for the new coronavirus. But I can assure you that scientists are hastening to develop vaccines. There's been some good news in Australia, for example. There's been some good news here in the United States of some potential discovery of vaccines. But unfortunately, we're still many months away from an effective vaccine that is spread around the world with enough doses that we can vaccinate millions, if not billions, of people. So, I was concerned about this coronavirus for those reasons. And I've been warning of this, as have other virology experts, infectious diseases experts, because we saw the risk for this. Given the ease of air travel, people traveling around the world, and that this virus has a long incubation period, around 14 days on average. Now, remember, that's an average. And that people with very mild symptoms or even unfortunately asymptomatic people can spread the virus. That means it's hard to contain. So that's kind of where we're at today. I do want to contrast this with flu a little bit. You hear a lot of sort of right-wing spin or non-science spin that, hey, the flu kills a lot more people. Well, look, influenza is a serious illness and it does kill a lot of people, but there are vaccines and treatments for flu, unlike coronavirus. And so you typically, with a flu outbreak, you have a lot of people that are immune. Some people get sick, and definitely some people get very sick and unfortunately succumb. But overall, for risk for pandemic threat, it's lower because we have enough people that are immune. So hopefully that answers that question that you see often of pushing back of why is this not, not a big deal because flu kills more people. So I wanted to debunk that myth a little bit. But let's dive into a few of your questions because I know lots of you posted on Twitter. So I thought that I would answer some of your questions and then we'll follow up with more information throughout the video. So Kristen asks, what are the approximate numbers of people in the US that have been tested? There's a 2-week period where you have it but are asymptomatic. And this is the period where you're most infectious and can spread it to hundreds. How can we trust the government numbers of overall infected? Well, that's a really good question. Of course. So, first of all, unfortunately, there's been, and I'm sure we've read, a lot of challenges with testing in this country. Unfortunately, Mr. Trump has bungled things despite repeated warnings from scientists. Hey, it's coming, it's coming, it's coming. Like, let's mobilize the tests. I and other experts weeks ago called for point of care testing as much as possible at our border cities and on the ports, especially in the West Coast and major ports of entry elsewhere in the United States. Unfortunately, that did not happen. And in fact, the CDC test was not functioning properly. And therefore, in the early stages of the spread of the infection in this country, we really didn't have a robust detection system. So unfortunately, the answer is it's hard to know how many cases are here in the US because, well, if you don't test for it, you aren't going to find it. Now, that being said, right now, as of today, the latest data, we're around 66 cases so far in the US that have been diagnosed. And 4 of those, of course, that are most concerning are what are known to be caused from community spread, meaning these are not folks that came back from China. These are not folks that were directly interacting with somebody known to be infected, like a spouse of somebody who came back from China. But instead, these 4 people got it in the community. Now, the first of those was a patient in Solano County, California, which is the same site of Travis Air Force Base, where some evacuees from China came who were infected. So more than likely in that first case of community spread, that likely came from someone from China that was brought back. And unfortunately, Trump's Health and Human Services Department did not protect their workers, who then went out in the community after they were around infected people. So you can imagine how that movie goes because we're living it. So bungling, unfortunately, yet again, by the Trump administration and not mobilizing testing and not adequately training workers that were around infected people to wear masks, gloves, and then be quarantined and tested repeatedly. And that likely has led to spread, well, unfortunately, wherever those folks go. In addition, we had continued travel of people from the hot zone over in China and other affected countries in Asia that have brought the virus back. But as I mentioned, we haven't been surveilling and doing a lot of testing. So what does this mean? What it means is community spread is here, folks, unfortunately. And it's been here for a while. And how do we know that? Well, one of the infected folks in the patients in Oregon, one of the patients there, he is a school worker, which obviously, when I saw that, was concerning, highly concerning. And this patient, the only patient thus far identified in Oregon, has unfortunately had symptoms starting about a week ago. So the next big thing that needs to be done, and I really hope that the Trump administration is doing this, along with, of course, local and state authorities, is very strong and swift contact tracing. So you want to trace all the contacts of the infected folks and quarantine those people. That is the only way to contain this virus. And I get asked a lot. So another question, Dr. Dena, can the virus be stopped? And the answer is, unfortunately, no. It cannot be stopped, but it can be contained. And containment is really important, especially early. This is why the missteps by the Trump administration have been very, very bad, because we want early and rapid detection, very swift identification of those that are infected and their contacts, and you quarantine them. So this is something as we talk more tonight and over the coming days about things that you can do to protect yourself, but also that we can all do to protect our community, our neighbors, and our loved ones. So again, stay tuned tonight as well as future broadcasts. I'll try to cover some things like that as well. So another question. Could you explain how the long incubation period and high transmissibility alters the mathematics of projecting the spread of COVID-19? And COVID-19 is the illness caused by this novel coronavirus. Why? So let's talk about that. That was from Tom, actually. And Tom, thanks for the question. So unfortunately, because this coronavirus has this relatively long incubation period, meaning the time that you got infected between the time you get sick, that's what an incubation period is. And with the coronavirus, it's an average of about 14 days. Now that's an average. That doesn't mean everybody after 14 days is good to go. Okay, bear that in mind. So about 14 days on average. And unfortunately, and this is the part that's not good news, unfortunately, is that people who have no symptoms can spread the virus, as well as those people with mild symptoms. They can be shedding virus, not really have any symptoms. And we'll talk about the symptoms in a moment. I should have mentioned that earlier. Sorry, guys. I'm doing this a little bit on the fly. It's just me here. So, so they can spread that virus. So asymptomatic folks, long incubation period means lots and lots of spread, hard to detect, unless you have very, very aggressive detection systems. And as soon as you identify sick people, you quarantine, quarantine, quarantine. Containment is key because it slows that virus down, which is critical. Now, one of the other things that we have kind of going for us a little bit is when this started. We're now entering March as of tomorrow. And coronaviruses, like flu viruses, tend to have a seasonality. So they tend to go up in the winter, sort of like the perfect conditions. And then in the summer, it's like getting rain in a wildfire. It sort of quenches it and the virus tends to slow down. So in the Northern Hemisphere, we probably have about another 4 to 6 weeks here of pretty intense conditions, unfortunately, for coronavirus. So here in the United States, Western Europe, other countries in the Northern Hemisphere, the month of March into early April, this is going to be really critical, especially for us here in the United States and in Western Europe, where the virus has just started to spread. I should also add the Middle East as well, where that is really about a week or two ahead of us. So the next month, 6 weeks, critical time. And you're going to see, we unfortunately will see more cases. I would anticipate that we'll hopefully see a little bit of a lightning decreasing of the number of new infections over the summer, but that's where, unfortunately, the Southern Hemisphere will become more of a hot zone. We'll talk a little bit more about that later. So again, thank you for the great question. So another question from Sear, S-E-A-R-E. Sear asks, how does sepsis develop in severe cases of COVID-19? And is there a way to best prime your body for the contraction of this rapidly spreading virus, given its rate of infectiousness and the lack of substantial diagnostic tools or vaccines? And guys, again, thanks for the great questions. So unfortunately, this virus is, other than specific groups, coronavirus, the way it really harms you, it doesn't, it's not, so let me back up, sorry. So the specific groups at highest risk are the very old. So people over the age of 80 have a much higher risk of having serious illness or death. Overall, based on the data coming from China, and again, this is from China, not here in the US, but still, I think, directionally correct information. The case fatality rate, meaning what's your percent, if you get the virus, what's your percent chance of dying? From China, they're saying around 2.3%. Based on their data, that's about 44,000+ folks, okay? But it ranges by age. If you're under the age of 50, your risk of death from this virus is a little bit worse, 2 to 3 times that of a regular flu. So not super serious increase. Instead of 0.1%, it's about 0.2 or 0.3%. So that's 3 cases in 1,000. Pretty low risk overall, similar to flu, or slightly worse. However, for folks at increasing age, the risk for serious illness or death is much higher. So folks over the age of 80, unfortunately, it looks like a mortality case fatality rate of close to 15%, and between ages of 50 and 80 increasing proportionally. So for those in our population who are immunocompromised, older, have comorbid conditions, this definitely represents, unfortunately, an increased risk for those of you, our loved ones, who fit into these categories. Now, as far as the virus causing sepsis, and back to the question from Sear, coronavirus itself, how it really seems to cause the most damage is in this second week of infection. So people can have either just no symptoms, a mild cold, or a more serious illness that gets into kind of the lower respiratory tract, bronchitis, pneumonia. Those are the patients that unfortunately tend to have very serious illness, sometimes critical illness. And it typically looks like with this virus that becomes worse and critically ill, where patients kind of crash, is in the second week, which is a little strange, it seems. But that's because it's not really the virus itself that's doing the damage, but that it causes this overwhelming immune reaction that then on the second week your own immune system essentially becomes hyperactive and can attack your own body. I know that sounds weird, but that's actually a lot of times with these viruses, what happens. And the same thing happened with the Spanish flu in 1918 as well. And we'll talk a little bit about that more a little bit later. So again, thank you for the great questions here. You guys are awesome with your great questions. So $3 asks, what might containment look like? What's the best case scenario in future? The WHO says we're still in linked epidemics stage, that COVID-19 is not yet freely spreading, and that we still have a chance of containment if robust action is taken to detect, isolate, and trace. Again, fabulous question. So right now, we certainly have an epidemic in China and an epidemic happening in South Korea, and now it looks like Iran and other places around the world. By most experts' definition, we are now squarely in the pandemic phase. It's the early stages of a pandemic, but pandemic nonetheless, which means an outbreak or epidemic in multiple countries or multiple continents. And we are there, unfortunately. Now, containment, it sort of depends on where you are. In China, they lock you down and they arrest you and drag you away if you leave your house. So at one point in China, within the last week or so, 700 million people were under lockdown of some sort. That is almost a tenth of the world's population, which is mind-blowing. And certainly in the hot zone near Wuhan, people are on lockdown. Not allowed to leave the house. Simply one member of the household can leave for like 2 hours every 3 days to pick up supplies. So really a total lockdown, people not going to work, people not traveling in or out of hot zones. Now, containment here is different. We live in a free society. We can forcibly detain people, sort of. There really aren't any rules, laws, or guidelines here. And this is something my husband pointed out a couple of days ago on Twitter. My husband, former Congressman Alan Grayson, talked about this, that we need a formal strategy, protocol, rules. Like, how do we identify people? What happens with them? We're not going to throw people in the gulag, but we need to keep our society safe. So as of today, what happens if you are coming and evacuated from the hot zone? People have been put into quarantine in military bases and other facilities, basically to keep them safe, to monitor them closely, but also to make sure they're not spreading the virus. With some of the other folks in the Pacific Northwest, a lot of times that we're now having these little outbreaks that are occurring in Oregon, in Washington State, and it looks like in the Bay Area in California near Solano County, and then we had a case in Santa Clara County as well. What will happen there? Aggressive contact tracing on anyone who's known to be infected, and then asking people to stay at home. And that's the key. You can stay at home, don't leave your house, don't go infect anybody else, stay at home, which will bring us back to what you can do. So let's talk about that. Question I get asked all the time, Dr. Dena, what can I do to protect myself, my children, my family, my loved ones? Well, some of these are really simple things, guys. Number 1, 2, 3, 4, 5. You know what I'm going to say. Wash your hands. And when I say wash your hands, warm soapy water count to 20. We all just do this. Yeah, I'm done. No, no, no. We want to kill, or in this case, viruses aren't alive, but basically inactivate all of the viral particles on your hands. So washa, 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 count, count, sing your favorite song, 20 seconds, okay? Warm soapy water. Sounds silly. It really works. Now, the other thing you want to do, don't go touching your face, especially if you're in public. If you're sick, you're going to get virus on your fingers. You're going to spread it to someone else. But moreover, you're going to infect yourself. You touch your eyes, your nose, your mouth. Don't do it. And so start practicing. It's actually really hard. You say, "Oh, I just touched my hair again." No, 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 no. Don't do that. So I'm in my own house. I did just wash my hands right before doing this, so I'm probably not going to infect myself. But when you are out and about, don't touch your face. Try not to use your fingertips. That sounds silly, but if you're going to hit an elevator button, don't shake hands with somebody. Do an elbow bump. Do a foot bump. There's been some really great videos of people talking about the Ebola foot bump. This is not Ebola. I don't want to scare people, so please don't freak out. But try to avoid touching people, other things with your fingertips. Stock up on prescription medicines. And it sounds a little weird, but a lot of pharmaceutical drugs, chemical drugs, are either made in China or they have sort of their backbones are made in China. So there could be a shortage. So make sure you have a couple of months supply if you can. It's a really good idea. So washing hands, don't touch your face, stock up on your prescription medicines. And if you are sick, please don't leave your house. Another question I got from Eric, he asked, it looks like there's a high chance of infection for many people who will have no or non-serious symptoms. If one is having similar symptoms but doesn't know it's COVID-19, what should one do? Okay, so the symptoms of COVID-19 caused by coronavirus are a lot like a common cold, which really, it's good and bad news. Common cold, no, who's afraid of the common cold? No one. So 80% of the time with coronavirus, mild infection, like a cold. Annoying. You stay at home, right? Stay at home. Rest up. Don't go out, because otherwise you're going to be infecting everyone else around you. So this is not something we should, race to the emergency room, get me tested because I have a mild infection. The time that you want to go and seek medical attention, if you certainly have comorbid conditions like diabetes, heart disease, chronic lung disease, immunosuppression, or the elderly, and especially if you have lower respiratory symptoms like bronchitis, pneumonia, go seek medical attention very, very quickly. It's important that you do that. But with a mild cold, do you normally go to the doctor for a mild cold? I personally, this is not medical advice. I personally don't, because why? It's typically a virus and there's really nothing that can be done for it. So why go and infect the rest of the world? So if you're sick, stay at home, please. Unless you, of course, really need to seek medical attention, then by all means, please do so. Now, one of the things that we do not have, but we desperately need, and if the Trump administration deemed me, the coronavirus czar, which, I mean, let's face it, they're not exactly science-based. That's not going to happen anytime soon. One of the things that I would do, besides mobilizing test kits, mobilizing protective gear for all of our healthcare workers, mobilizing education for the public at large, as well as for our medical personnel so they can protect themselves. One of the things that we absolutely must be doing is, educating the public. We need folks to, first of all, don't freak out. Okay, so that's going to be critical. But the last thing that we need to do, of course, is we need to teach our medical staff what to do. Right, triage centers. We need to set those up. How about a call center online? Hey, I think I have coronavirus. What should I do? Do we want people to be going to the hospital? Well, if people who are infected with coronavirus start going to every hospital, then everyone else gets infected at the hospital. Not a good idea, especially if the hospitals are not trained and equipped to deal with incoming coronavirus patients. So we need triage centers that are specifically set up that if you live I'm in the Orlando area, hey, then call this number, go to this site, and a specific site that will triage people that are suspected to have coronavirus infections. But again, unless you're seriously ill, probably best not to go to places where you can contaminate other people or yourself potentially get infected. So hopefully that makes sense. And again, sorry for the little bit of the hiccups here. It's just as I said, just me. So another question from Roro says, yesterday, this person was out shopping and said that at the store they were at, they were handing out sanitizing wipes as they entered the store to clean the bar in the shopping cart and also at every cashier. I like this place. Gosh, I'd love to name names, but I don't feel I should endorse, but I really like that store, Roro. So good thinking. So does this help, or is it like nuclear duck and tuck? That's pretty funny. Can you put together a list of preventive best practices in public spaces? So that is a great question, Roro, and kudos to this awesome store that you're shopping for putting out sanitizing wipes. It's a great idea. Any surface to decontaminate it, wipe your hands because obviously if you're out shopping, you can't be walking around with a sink and hot water and warm water and soap. So carrying sanitizing wipes is a great idea. It's awesome that the store is doing that. Definitely a very good idea. We talked about some of the other preventive measures that one can do. Hand washing. Try not to use your fingertips to touch stuff. Use elbows or knees if you're going to open the door or your elbow. I know it sounds silly, but every bit counts. Let's see here. Thinking Out Loud asks, any evidence that standard antivirals already available result in less serious symptoms or possibly limit virus shedding and therefore limit contagion? Thanks. Well, thanks for the question. So unfortunately, right now, there are no approved medicines or drugs that seem to be highly effective against this coronavirus. There's been some anecdotal discussion of using some of the anti-HIV medicines, but thus far, certainly haven't seen any convincing data that those are effective. And there are no other, unfortunately, antivirals that are available, meaning they've been approved by the FDA, so they're widely available. There is one drug that is being tested right now called remdesivir. It's an experimental drug that was being developed for Ebola. That's not the drug I was developing. It's a different one that I was working on. So this drug appears to potentially have some activity against the coronavirus. It's being provided really on a case-by-case basis. There's an emergency pathway at FDA to provide experimental medicines exactly in situations like that. So our FDA, I'm really proud that they were able to expedite this. A patient in Washington State was apparently treated, and there seemed to be, again, anecdotal evidence. This is one patient only, so don't take it to the bank or anything, but it looks like that patient may have potentially had some sort of response, but it is way too early to say anything definitively. So that is, please do not hang your hat on that. So the bad news is nothing that has been shown to work, potentially a glimmer of hope that there might be a medicine, but the reality is what we really need is a vaccine. And the reason I say that is if you go back to the Spanish flu of 1918, it came in really a couple of waves. Just like flu season, we talked about it, kind of ramps up in October, and then by April, Northern Hemisphere, that's sort of end of flu season. And then the opposite happens in the Southern Hemisphere. So in the Spanish flu pandemic in 1918, what happened was that initially that first wave here in the United States and elsewhere in the Northern Hemisphere started around March 1918, just like 2020, ding, 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 at least for us here in the United States and Western Europe. And sort of there was a small wave, relatively small wave, but then it kind of petered out as the summer months came. So think of this as sort of like little brush fires, okay, like in a wildfire situation. Right now, we have some pretty bad brush fires potentially here in the United States. We don't know how big they are, but it's like, like California, when the Santa Ana winds blow, the conditions, unfortunately, are really good for coronavirus to spread. Okay. So that's the situation we're in right now. That's the bad news. The good news is hopefully summer comes. That's like a quenching rain for coronavirus. So hopefully that will happen. Summer comes and we see the number of cases die down in the Northern Hemisphere. And then cross your fingers and hope for the Southern Hemisphere. Now, but the bad news is that come next fall, and in 1918 Spanish flu, the fall, that second wave, was where you saw this huge spike in cases. And in fact, that was where the vast majority of people got infected and died, was that second wave. So we do have a little bit of time and a window to hopefully the Trump administration to get their act together and mobilize test kits, educate the healthcare workers, provide them with protective gear, get triage centers located all around the country so that sick patients can be sent there. We had some system set up by Ron Klain. He actually set up a good system, our former Ebola czar. This was during the Ebola outbreak that he set up triage centers as the Ebola czar, which makes sense, and referring patients to hospitalized that were specialized to be able to take care of these patients safely for the patient, but also for healthcare staff. So we have a little bit of time, but that second wave, my prediction is that's what's going to happen with coronavirus. We're going to have this first wave. I hope that it's going to be relatively contained, although never underestimate the Trump administration's ability to bungle it because they already are, which is unfortunate because it puts all of us at risk. So I do want to be clear. I am rooting for the Trump administration to be successful here because our health, all of our health, depends on them to do a great job. And so this is one of the reasons I've been sounding the alarm, like, hello, let's go, mobilize, mobilize, mobilize. But unfortunately, thus far, there's little evidence that the Trump administration has done that, and is relying on Wall Street guys instead of our top scientists. So I would like to see Dr. Tony Fauci out in the forefront, speaking about this virus. He's the NIH's expert, and frankly, he should be one of the leaders guiding our action to respond to this. So with that, friends, I hope this has been informative. I do apologize it wasn't the smoothest, but it is just me, and I just wanted to get the information out there. So forgive the few hiccups. I will try to do more broadcasts. I will post some stuff on Twitter asking for questions. So I will come back and ask more questions again. I see lots of questions coming by on the screen. So I will be back, but I really appreciate you joining me tonight. And thank you for all the great questions. Don't panic. Just be safe. Wash your hands. Don't touch stuff. Stay home if you're sick. And again, don't freak out. This is not the end of the world, but just be vigilant and try to make some smart decisions about, not going to where a bunch of people are hanging out. Don't be shaking hands and protect yourself. Hope this has been helpful, friends. I'll look forward to seeing you again. Let's all cross our fingers that this is not going to be a huge outbreak here in the US, but unfortunately, all signs are that we're going to see many more cases over the coming weeks. Thanks for joining me. I'll talk to you guys soon. Thanks.